This Friday marks 2 years since we said that the global spread of COVID-19 could be characterized as a pandemic. As a reminder, we made that assessment 6 weeks after we declared COVID-19 a global health emergency, when there were fewer than 100 cases and no deaths outside China. 2 years later, more than 6 million people have died. Although reported cases and deaths are declining globally, and several countries have lifted restrictions, the pandemic is far from over, and it will not be over anywhere until it's over everywhere.
What do we know about the global health architecture? The global struggle against the COVID-19 pandemic has pushed countries worldwide to recognize the importance of incorporating health cooperation in their agenda. Terms such as global health diplomacy and health cooperation, referring to the interaction between countries to strengthen their relations via efforts to improve their health resilience, are now the highlight of most forms of cooperation. Not only organizations like the World Health Organization and other UN-related bodies focusing on improving health or fighting diseases, but now other platforms and groupings such as the G20 or ASEAN are also putting this high on their agenda. Frontier forums that tackle long-standing issues like climate change have incorporated their own health programs, such as programs to build sustainable and resilient health systems through advocating the voice and role of health professionals and research. What is global health architecture? Global health architecture is defined as the relationship between the many different actors engaged in global health and the processes through which they work together. The COVID-19 pandemic has brought about momentum to shift recognition and attention from the level of threats towards states to the level of threats towards human beings. Witnessing the transnational nature of these threats, it has become more obvious that the safety of a country's population begins with the safety and survival of others. Strengthening the global health architecture is a topic high on the current international agenda. This includes how to improve governance and financing of pandemic preparedness and response. Such positive outlook has been seen in the speed of assembly and push for global health initiatives. For example, the COVAX, multilateral initiative that aims at ensuring more equitable access to COVID-19 vaccines, particularly for countries which struggled to secure their own.
The truth is that global health architecture is only as strong as its component parts. Think of global health architecture as a chain where all the links need to be strong. So internally, countries can contribute by ensuring that their own capacity for prevention, preparedness, and response to pandemics is strong. Because if the countries are weak and not prepared, the whole global health architecture is going to be compromised. It's going to be the weak link in the chain. So when I say they have to strengthen their own capacity, what do I mean by this? What I mean is they must ensure that they have robust and resilient health systems. This means having sufficient doctors and nurses, sufficient money to fund all the activities, sufficient hospital capacity, sufficient medicine and vaccine supply, importantly, very robust information systems, and of course, finally, good governance and coordination between all the different agencies.
So what do countries need to do? I think the first one is really to first ensure that they actually are committed to the obligations under the international health regulation, particularly when it comes to disease surveillance and response, right? So it's really vigilance when it comes to any disease outbreak and making sure that once the disease has spread, they're able to put in place the right pandemic preparedness and response mechanism. So that is at the national level. And, you know, it's a long agenda when you talk about investments in pandemic preparedness and response, making sure that your health systems are robust enough, your hospitals don't get overwhelmed, you have the right personnel, you have in place a lot of support for people who will get the disease, at the same time ensuring to the extent possible that you minimize the damage. I think there's a lot of lessons from COVID-19 that we can think about. At the global level, you really need to ensure that you support the WHO when it comes to their efforts in disease surveillance and response, and making sure that that mandate is actually strengthened. And member states can actually help a lot, in ensuring that a global institution like the WHO is being strengthened, which includes, of course, addressing issues of funding, right? Making sure that the WHO has money to carry out its what it's supposed to do.
Yet, we are also seeing challenges to such a notion. Health agenda risks being derailed from the forefront of global agenda as it loses out to the return of traditional issues in international relations. For instance, recovery agenda face hindrance from the current political polarization between great powers who struggle to put common agenda before geopolitical interests amidst the conflict in Europe. This has put some setbacks to the progress on key global health cooperation agenda. What are the challenges? At the onset of the outbreak of the COVID-19 pandemic, global health cooperation was majorly seen as insufficient. One criticism had been about the state of global health governance, especially the performance of the World Health Organization, which many considered as slow in recognizing the scale of and thus responding to the international outbreak. As the world gradually moves on from the earlier pandemic struggles into the new normal, plenty of health challenges remain. One of the biggest challenges is the inequality between national health system capacities and access to global health public goods across the globe. Despite the many recent initiatives where countries are shown to be willing to provide and contribute to the provision of global health public goods, the gaps between the capacity of countries in responding to emergency health issues or even long-standing health issues remain wide. Mirroring domestic conditions, the lower the socio-economic position of a country, the less they have access to proper healthcare systems for their population. One indicator of this is the difference in the rate of life expectancy in low-income countries and high-income countries, respectively numbering around 62 and 81 years. This difference in capacities was further shown in countries' capacity to respond to the COVID-19 pandemic. For example, during the early months of 2021, when the production of COVID vaccines started to rise, high-income countries dominated their purchases. These countries dominated vaccine purchases during the course of the first year since vaccines were discovered. Data in March 2021 shows that more than half, or 54%, of global vaccines have been ordered by high-income countries, representing only 19% of global vaccine need.
And the main reason for this, of course, is the rich countries, they have the money to buy these vaccines at a price which is profitable for the pharmaceutical companies. And what happens is they were able very early on to secure the contract for supplies. So what we saw was many rich countries actually hoarding vaccine supplies way beyond what they actually need, okay? Stockpiling and hoarding. So this means that about 2.4 billion people up till today have not received even their first dose of the vaccine. And 70% of that 2.4 billion is actually in the poorer developing countries. And booster doses at the moment cover only 1/3 of the world population, and of course, mostly in the developed countries. Okay, what can you ask? What might happen in the future? This inequity is the main reason for a multilateral initiative called COVAX. You might have heard of this. This is basically the WHO is behind this, together with UNICEF and Gavi, Global Alliance for Vaccine Immunization, and with strong backing by the World Bank. So this was created specifically to ensure global equitable access to COVID-19 vaccines. However,
high-income countries. In certain lower-income countries, many of the most at-risk people in society, healthcare workers, the elderly, and those with underlying health conditions, are going unprotected, while young, healthy adults receive booster doses in wealthier countries. As of May 2022, only 57 countries have vaccinated 70% of their population. Almost all of them are high-income countries. A report by Lancet shows that the G7 countries have been failing to fulfill their 2021 commitment and pledge to provide vaccine access to the middle and lower income countries. The difference in countries' policies over border control and restrictions on people movements has also raised concerns. Even more discouraging, the world is also seeing some patterns of politicization of health issues and subsequently politicization towards health aids. Thus, instead of global health cooperation, we have seen more of global health diplomacy, entailing the primacy of national interest and the need for negotiation, dispute settlement, and other political processes before we see direct help and support to the most vulnerable.
Vaccine diplomacy is an example of the extent to which, the ugly side of global health diplomacy was reflected, because they used it as part of their foreign policy to perhaps for their political purposes, so to speak. I mean, you could see that you had the mass diplomacy from other countries, and you had the vax diplomacy, and then you also have this competition, right? I mean, China was there right at the forefront when the US was trying to get its act together. I would say, I think to be fair, that they actually helped a lot, but in the end there were also some limitations concerned, and the US I think, having realized that China had the advantage, then finally came in. But as it turned out, if you look at the quality of that contribution, if you like, right, it appears to be that there was the decision to give which country was, of course, really informed by the foreign policy interest of those donors that have the ability to give vaccines.
Now, globally during the pandemic, a very common mantra behind many policy decisions in most countries, I would say, in the world, was this: our policies are driven and informed by the science. Okay, you hear that all the time. Now, that's well and good. I'm a scientist by training. Of course, I believe that policies, especially when it comes to health, should be driven by science and by evidence. Okay? But as illustrated by the examples I just mentioned, okay, the reality is this: politics will always trump science. Okay? You see that over and over again. Okay, we as scientists, we want to believe. Here's the evidence, here's the science, just be guided by that. Doesn't happen. Politics will always trump science.
So what is being done to tackle these challenges? International forums like the World Health Summit are focusing on creating development strategies to find and distribute global health public goods more effectively, as well as strengthen health facilities and overall preparedness as part of the plan to better respond to future health emergencies. But concerns remain that breakthrough on efforts to improve public health and reduce health inequalities will be limited to the confines of national borders. How can Indonesia contribute to this? The government of Indonesia has been involved in a number of global health initiatives, putting it in a pole position between developing countries in their push to promote more cooperation. Indonesia is a strong proponent of the COVAX initiative and active in the COVAX Advanced Market Commitment Engagement Group, with a focus on vaccine inequality and a hope that the initiative will continue beyond the pandemic.
Indonesia have active involvement in COVAX system, since that our interest is to ensure an equitable access to COVID-19 vaccines, particularly is for the vulnerable population, including such as frontliners in low-middle income countries. And last year, of course, Indonesia was proud to have led the COVAX Advanced Market Commitment in the meeting that we are ensuring the successful delivery of a free COVID-19 vaccine to 92 low and middle income countries. And we know that since October 2022, COVAX has distributed like 1.75 million, not even million, a billion doses of vaccine globally. On average, it's like 51% of the population in 92. If we call that advanced market commitment of the COVAX country, which already complete the primary series of COVID-19 vaccines, which means is 2 doses. And for Indonesia itself, by April 2022, we received like 130 million doses of vaccine from COVAX scheme, and some from bilateral dose sharing.
As part of its G20 presidency agenda, Indonesia is strongly emphasizing on G20's recovery agenda via goals such as to strengthen the global health architecture to be more responsive towards health emergencies. As representative of the developing world, Indonesia has the interest to advocate that health issues continue to be part of the agendas of the world's top 20 wealthiest states. Indonesia also initiates the Global Health Protocol Standards to promote harmonization between countries' policies and protocol standards, such as on vaccine certificates.
This year, it is the Indian presidency, but as part of the Troika structure in the G20, Indonesia will still continue to play a leading role supporting for Indian presidency agenda. And particularly, we know that such as strengthening global health architecture and resilience for the future pandemics to anticipate for the pandemics, as we know that we have like pandemic funds that we still continue, and then health protocol, the implementation of standardized of the health protocols still be involvement and led by Indonesia.
Indonesia is also a strong promoter of recovery agenda via ASEAN, particularly the ASEAN +3 mechanism. One example of Indonesia's active role is through the ASEAN Center of Public Health Emergencies and Emerging Diseases.
Of course, because of the pandemic COVID-19, it's already sparked a new spirit at the global collaboration and alliance to pave way how to have more resilience and pandemic action in terms of prevent and surely current situation that how to need urgently ending this COVID-19 pandemic.
Your question is which multilateral framework is the most important. In my view, there's only one framework, okay? But it is a framework which, in my view, is an inclusive one of all the key players that will make global health cooperation happen and will make it sustainable and resilient to future pandemics.
At the global level, I think we should not really discount the contribution that the WHO has done, and continues to do, to give us information, to coordinate many of the assistance when it comes to vaccine access and other therapeutics, right? So the UN and WHO work has really been very useful. One would also cite the contribution of other frameworks, multilateral frameworks like the G20, and that when they had the meeting, you actually got them, countries like the US, Japan, right, and countries from the EU to come and help. And don't forget, there are also other frameworks like the Gavi Alliance, GIVI, that looks at basically ensuring, it's like a risk pooling mechanism that helps countries in the procurement of vaccines and ensuring that there is equitable access to these vaccines. When you talk about Asia, East Asia, the frameworks under the ASEAN +3 in helping address COVID-19, and within ASEAN, all the mechanisms, all the programs that were geared towards addressing and exchanging information, getting countries updated with what's the latest, the best practices in dealing with cases, even down to also helping out in diagnostics. All of this underscore or underline the importance of multilateral efforts in dealing with really such a huge global problem.
Ultimately, for Indonesia, the promotion of collective multilateral provision of global public goods is of utmost importance in the effort to push for more global health cooperation. This effort includes the pooling of resources, including financing, in the effort to procure global public goods, and requires cooperation at the global level via multilateral institutions, noting the massive challenge of coordination and facilitation of a transnational problem like a pandemic.